Yes.
CDC says measles cases are rising across the country. More than 1,500 cases reported now, with some new outbreaks in Utah and Arizona. Cases are now spreading across 42 states, as well as Washington, D.C., and that includes 3 people who have died and nearly 150 hospitalizations so far. Johns Hopkins is reporting less than 93% of kindergartners are fully vaccinated at this point. That's below the recommended 95% needed to prevent the spread of measles. Measles was largely eliminated in this country in 2000, so this is the largest outbreak since then. Let's bring in our guest, Dr. Joanna Parga-Belinkie, a pediatrician, joining us from Philadelphia this morning. Dr. Joe, thanks for joining us. We appreciate it.
Thanks for having me on to talk about this.
Let's start with those vaccination rates for measles. They're down. They're under 95%. What's the danger when we get to those levels?
The danger there is that the measles virus is a virus that is really good at spreading. So you mentioned it, you need to have over 95% of people vaccinated to prevent outbreaks like the ones we're seeing now. And we've seen a decline in vaccinations since about 2019 around the pandemic. And so we really need to get these vaccination rates up.
Joe, you talk about the uptick in measles. How do we turn that trend around and get more kids vaccinated?
I think it's awareness, knowing that the vaccine is something that is generally very safe for children. You've heard about the MMR vaccine, that's measles, mumps, and rubella. And there's also the MMRV vaccine, which includes varicella. And you can get vaccinated, and generally pediatricians will use the MMR vaccine at about 12 to 18 months is what's recommended. But if you're in an area where there is an outbreak, you could get vaccinated as early as 6 months after talking with your pediatrician. So I think everybody should be talking with their pediatrician, particularly if they're in an outbreak zone, about when they can get that vaccine.
Are you hearing about confusion from parents about what to do at this point, given some of the new mandates and new guidance from the Department of Health and Human Services?
Yeah, I think unfortunately parents are a little bit confused, but pediatricians are not. And so I always tell families to look at the American Academy of Pediatrics recommended schedule for vaccination. It's really nicely laid out to help them understand when vaccines are due for their children. And also, I had mentioned MMR and MMRV because that had been something that was recently discussed at a recent ACIP meeting to kind of talk about immunization. And the addition of varicella does cause a little bit more fever in children, making them a little bit more susceptible to febrile seizures. And that is why there was a discussion about that. That's something we've known for a long time. So again, not new for pediatricians. And most pediatricians' offices stock the MMR vaccine for that 12 to 18 month period, knowing that they don't want to give a varicella with the MMR until a little bit later because of that fever risk. So this is not new for pediatricians, and we have a recommended schedule from the American Academy of Pediatrics.
So, Dr. Joe, do you think people understand the importance of vaccination with dealing with diseases like measles?
I think people do. Most parents want to vaccinate their children. So most parents are trying to get these vaccines in. I think sometimes I hear from parents that they're hesitant about the primary vaccine series, which starts, essentially from birth with the hepatitis B vaccine, but 2, 4, and 6 months are times when we give a lot of vaccinations to children. And I think parents, are wary of that. We're vaccinating against many different diseases. There's different shots that the children get. But there is a reason behind the vaccine schedule. It's very, very well thought out. So I want parents to not be concerned about the vaccination schedule that the American Academy of Pediatrics recommends. It's very safe for children. It's very well tested, and it's going to prevent our most vulnerable population from getting sick.
Dr. Joanna Parga-Belinkie, thank you for joining us from Philadelphia this morning. And we've had the